The invited speaker of this morning is the Associate Professor Svetla Boytcheva. Besides being my university lecturer, she has a very long experience in machine learning, natural language processing, and bioinformatics. And she has participated in a long list of EU-funded and national-funded research projects, including on bioinformatics. She's currently participating, for example, in ExaMode, which is a research project on which is working the company OnToText. It's trading as OnToText, and Svetla Boytcheva is actually the senior research lead in this very well-known company. It's called, the company is known by the name currently as Sirma AI, trading as OnToText, as I said. So please, Svetla, start your presentation. So just to mention that Svetla will talk about the clinical...
Can you see my screen?
Yes, we see it. So I'm muting myself and you will continue.
Can you hear me?
I can hear you.
Yes, I can.
Okay, thank you. Thank you for the invitation to present this talk at this conference, and thank you to Irina Temnikova for a nice presentation. And I'm going to present today clinical natural language processing in Bulgaria. And the talk is organized as follows. First, I will discuss briefly the clinical documents in Bulgarian, some resources which we used for processing those documents, some computational methods, experiment. The medical domain is a data-intensive domain, and due to the recent penetration of the information and communication technology, data that are produced by healthcare sector. On the one hand, and on the other hand, the biomedical research, like research publications, are accelerating every day. The information for the patients mainly is available like free text in electronic health record systems, or even it's organized somehow in semi-structured format in electronic health records. Huge pieces of information is still stored as clinical narratives. And the task related to processing clinical documents can be considered as information extraction tasks or text mining tasks, which require extraction of information from discharge letters or outpatient records, or from electronic health records like diagnosis, different symptoms, treatment information, risk factors, or related events to the environment and the habits of the patients. The other task, which is quite important, is related to data normalization. Data normalization actually requires those extracted pieces of information to be mapped to standard taxonomies, classifications, ontologies, and etc., in order to have disambiguation of all this information and to be able further to process it and to make different inferences, different patterns to be found, and to find very complex causality relations. And the third group of tasks are actually related to already structured information, which we actually extract from the first task, from text mining, then normalize and map to different ontologies and classification schemes. And the data mining actually tries to identify interrelations between symptoms, risk factors, and different disease relations, so like comorbidities, to predict different events, and this is really important for prevention and treatment of diseases. The discharge letters in Bulgaria are usually short narratives. They are free text, usually 2-3 pages. And they have very specific structure, which is according to the national law. And there are predefined sections, the following sections: diagnosis, case history, it's also called anamnesis, short review of past diseases which are related to the current case, allergies and other risk factors, family and medical history, description of the patient status, the clinical tests, lab data which were made either before the hospitalization or during the hospital stay, medical examiner's comments, and when the patient is discharged, there is a short debate and prescription for treatment. This structure is mandatory, which means we have a very well-defined structure, but still in some discharge letters, some of those sections are missing. Here is presented for a small excerpt of discharge letters, about 6,000 discharge letters, statistics, the presence of different sections. And anyway, even some sections are missing, the context can be really well identified, and the context information structure is quite with quite good precision. The patient records are other clinical narratives, which are again with some structured sections, but they have several huge sections with a lot of free text, which actually allows us to extract from here very important information. The XML formatted patient record actually has structured only the administrative information, which is important for reimbursement, but the information for the current patient status compliance is in free text. And here as an example for the free text in anamnesis, in outpatient records, which starts with patient history, with patient status, different examines, and prescribed therapy. The medical terminology which is used in these documents is mixture of between Latin and Latin. Here in this example, you can see we have Latin in Latin. And here in the last row, you can see we have Latin terms which are transcribed with Cyrillic letters. And we have also corresponding medical terminology in Bulgarian. And those terminologies are mixed in different combinations. It depends on the medical doctor which type of terminology will use, and usually are used different combinations. This one requires not only to try to process the medical text in Bulgarian, but also to start processing the Latin medical terminology which is used in those documents. We have really a challenging task because the Latin terminology is actually a combination between different roots and suffixes in Latin and Greek. And if we try to make a parallel between the transliteration and the original term, there are huge number of rules for transliteration. One rules are applied for terminology with Greek, which is based on the Greek terms, and another transliteration for Latin terms. But there are also hybrid terms which use roots, prefixes, and suffixes in both Greek and Latin, like on the next slide, like mammogram, hypertension, cardiovascular, and etc., which requires each part of the term to be transliterated depending on on that whether it's based on Latin or Greek. And also we faced a lot of problems with transliteration and parallel between Latin and transliterated in Cyrillic Latin, because there are no resources for such terminology in transliterated Latin. And when we start transliterated Latin terms, there are also included non-Latin and non-Greek words. For instance, for some syndromes are used different names of persons which should be transliterated depending on their origins. And also a lot of additional symbols are used, for instance, in the thesis, like different letters in Roman and etc., which can't be transliterated, which requires development of very sophisticated transliteration tool for medical terminology. For nomenclatures which are used to assign and to normalize data, are used several international nomenclatures which are used from Bulgarian Ministry of Health, and they are approved and applied in all the hospitals and all clinics when such documents are developed. Such are the disease-related ontologies, anatomic, therapeutic, chemical classification, which is used for drugs and medicine, logical observation, identification, identifiers, names and codes, which is used for clinical and lab results. For procedures is used Australian classification and health interventions. The codes for ICD-10 clinical modification they can be 3 symbols or 4 symbols, or many other expansions can be used, but in Bulgaria they are used up to 4 symbols. And terminologic anatomica, actually terminologia anatomica is a very classic document for different anatomical organs and systems in Latin. This is another source which we use as a basis for development of resources. Unfortunately, this document is very ancient and only scanned and really bad quality versions are available. But I will discuss later how we managed to get this information. And the major obstacle in processing clinical texts is that there is used a broken medical language. A lot of concatenated words, because usually physicians are short in time and they are in hurry to produce this documentation. Missing punctuation, just telegraphic style without full stops or commas or any other punctuation, a lot of typos, a lot of transliterations which are freely transliterated, not according to the rules, a lot of homoglyphs because usually physicians are tend not to shift between Cyrillic and Latin, and they can type the same symbols, for instance, O in Latin or in Cyrillic. For them, it doesn't matter because it seems equivalent. Here is an example for one diagnosis. This is for one patient from one patient record. You can see here more than 40 diagnoses are listed, and you can imagine how this can be normalized and mapped to different classifications and ontologies, because here are used also a lot of abbreviations, and also there are some typos, and also a lot of transliterated Latin terms, etc. And during the we developed for different projects a lot of tools to deal with different types of information which can be extracted. Initially, we started dealing with very specific types terms and types of tasks. Here is presented the task for extraction of the current treatment of the patient, because when the patient is actually hospitalized, the patient actually brings a lot of documents, and already some drugs are prescribed before hospitalization, and when the patient is actually hospitalized, the hospital information system should be able somehow to identify the previous treatment and to combine or to change some of this previous treatment with the current treatment during hospitalization. This is a very important task, and because this information is available only in the clinical documents produced by the general practitioner in free text, we need to be able to identify medications. For this one, we used a huge list of current medications which are allowed to be actually trade in the Bulgarian pharmacies. This list usually changes every 2 weeks, because some medications, some new medications are actually added to lists, and some medications are deleted. And this requires frequently update of the list of medications. We produced a lot of rules, approximately 150 rules, and we use a rule-based approach to identify medication, the current dosage frequency, and the dosage and frequency can be actually combined in different ways, and they can be also represented with different different patterns. The most difficult task was to identify the scope of medication dosage frequency presence and these narratives, which dosage frequency to which medication refers. And we used, I already mentioned, a lot of rules. These experiments were performed for about 6,000 discharge letters for very specific type of diseases for endocrine and metabolic disorders, which actually means we have very specific rules regarding the patient records. And the recall was really high, approximately 86%, and the precision was also high, approximately 92%. This tools which were developed during the project were integrated with hospital information system, and here you can see when the patient is hospitalized, here is actually mentioned the treatment when the patient is hospitalized, and the system is automatically connected with the hospital pharmacy. It reports the identified medications and their treatment and sends the message to the hospital pharmacy to check whether these drugs and medications are available. And also the doctors are able to change this treatment or just to continue the duration of the treatment and combine this treatment with new ones. The other source which we used was the Bulgarian diabetes register. This register is developed automatically. It's generated automatically from the outpatient records, which are produced by general practitioners and specialists in clinics, and they are sent to the National Health Insurance Fund in XML format, but still with huge pieces of free text. And from those outpatient records are extracted some significant parts related to the lab results, to some clinical treatment, some symptoms, diseases, etc., and is produced semi-structured format, which allows to process this information further for different patterns and to search for risk factors. This is a population-based register for all Bulgarian citizens, which are actually who have health insurance and contains for more than 5.5 million people all their visits to general practitioners and specialists for about 10 years. Actually, this was a huge resource, and this resource actually needs further investigation. When we started working with this huge number of outpatient records, actually we faced the limitations of our previous solutions because here we have the national resources, and these resources actually contain very different vocabulary from those which we processed earlier, because they were based on only one hospital, and here in different regions of Bulgaria are used different vocabularies, different types of narrative, and etc. And we saw here actually the problem because there are no resources that are available for processing medical terminology in Bulgaria, and we needed to develop such resources. The first task which we solved was the extraction of blood pressure expressions. Here presented the small pace of presentations. The presentations are several hundreds different presentations we identified in the resource, and actually we developed very complicated classification for different clinical numerical data which are presented in the documents, and we developed different algorithms for extracting those numerical clinical data and to assigning them to the corresponding factors like blood pressure, like glucose, like, for instance, frequency, etc. This was applied for the whole diabetes register, and actually produced really high accuracy results. But this was a long way before actually achieving such results. And we faced actually the problem that also some of those numericals are somehow nested, and we should be able to identify the scope in which they're presented and which one to which actually type refers. And besides the huge variety of their representations for each observation, for instance, here for height, we have also several hundreds of representations of the phrase which denotes the current height of the patient. Several hundreds for this Riberochi is the method for blood pressure measuring, and etc. For each of them, we faced a huge number of varieties, and we developed this taxonomy for different types of numericals, and also context-free grammar. And we used, based on this context-free grammar, different regular expressions to extract those observations. And our later task was to identify different findings in the texts when we apply text mining techniques to identify, for instance, previous diseases, some symptoms, etc. We need to be able to normalize those findings to standard ontologies, classifications, and nomenclatures in order later to process these findings. But also for this task, we didn't have resources like the list of all possible diseases. We have only the classification of diseases, but diseases by itself, which are listed by um, uh, medical professionals, are quite different from the classification um, uh, terms which are used. That's why our first task was to try to map any diagnosis written in any format with different paraphrases, even with different words which have nothing to do with the classification terms to the specific codes for the international classification of diseases. Such resources were not available. We also have no available resources like list of all symptoms, list of all organs, anatomical organs in Bulgarian, etc. And because we needed to do this for relatively short time, we started digging the web and searching for resources. Of course, really nice resources can be found in BioPortal. There are available different mappings of all those classifications and um, ontologies. And a really, really good resource with structured information is Wikidata. Wikidata actually contains a lot of information. For instance, here for COVID-19, you can see the labels. We try to explore multilinguality of the labels in Wikidata. For instance, for COVID-19, you can see not only the English labels, also different alias of those labels, and also for different languages are available not only labels, but also different synonyms of the term. Actually, this Wikidata resource is also a very good resource from which we can start, because it contains not only labels in different languages, but it contains also different references to those classifications. Um, we mentioned some classifications. Wikidata is a collaborative project, which means not for all terms we can find such rich information, and for some terms such information is available. For the others, we have just limited um, links to some classifications and ontologies for COVID-19, because it's quite popular now. We have a very, very rich representation, and we have also reference here to IC the 10, to disease ontology, and to other standard classifications. We tried with just small Sparkle queries and from the wiki data query endpoint service to check what is available for those mentioned classifications and ontologies for Bulgarian. And here you can see for this very simple query are identified about 10,000 records for diseases with labels in Bulgarian. And here are also available the ICD-10 codes, disease ontology codes, MASH codes, human phenotype ontology, Mondo, Orphanet, and etc. Actually, this results seems good, but it's not good for our classification task because in the ICD-10 we have approximately 11,000 classes, and this is less than one example per class. And probably for some classes we lack any data. And the next task was how to enlarge this corpora in order to generate automatically a training corpora which will be sufficient in size for our extreme classification task where we need to classify diagnoses to 11,000 classes. And we applied different mappings between ontologies because I already mentioned Wikidata don't contains all the mappings to the resource. And here is in World Health Organization ICD-10 classification. You can see how it's organized. It has three sign codes. Also, these codes on the next level are separated on four sign codes, etc. And here, BioPortal is another linked open data resource, which is quite useful for this task. Again, using different Sparkle queries and using those ontologies and classifications in federated queries, we can map the terms from Wikidata to these ontologies, and or in case some terms from these ontologies are not available in Wikidata, we can also backpropagate those resources, and we can feed the Wikidata with these terms. Also, here this is the human disease ontology, are available some mappings, and we can benefit from those available mappings to further enlarge our mappings in our findings. We also used queries not only for Bulgarian but for English, and we applied machine translation for from Bulgarian to from English to Bulgarian, from English to Latin, and also we applied our transliteration tools from Latin to Cyrillic. The resource which we used in addition, which is again a free open resource, this is the alphabetical index. This is translated in Bulgarian and provided by Ministry of Health for all possible rules for classification of diseases to different codes. This resource actually is not quite good for processing because it was available in PDF format, and you can see here the references are in different bullets for different levels, and very complicated tools were developed in order to extract the particular references. For instance, here is arthritis with colitis, and it can be classified either with this code or with this code. Also, there are some references to other sources, and actually this one requires to process a lot of information in such unstructured format. The final resource which was developed is about 370,000 4 sign classifications for diagnosis and about 190,000 for 3-sign classifications of diagnosis. The ICD-10 codes per different diagnoses are quite imbalanced. Here we can see for one of them we have approximately 10,000, and there are a lot of diagnoses for which we have just one entry in our training resource. Here are some of the automatically generated resources for this classification task. Here are those diagnoses, and the first column are the associated ICD-10 codes. This is fully automatically generated resource, and it actually was further validated and a little bit cleaned again semi-automatically on several iterations in order to ensure that all the phrases are valid in the medical terminology. Further tasks which we are currently aimed to apply are classification with Slavic birth, multilingual birth, bio-birth, and as a baseline, naive Bayes and support vector machines. But actually, those transformers based on birth are trained on just usual texts, and they require further fine-tuning with terminology in Bulgarian for medical terms. That's why we're wrote a lot of resources which are available on the web and are trusted resources like medical scientific publications, medical portals which are run by medical professionals, and they contain a lot of different information for this kind of terminology. Another task which we're currently dealing is to generate synthetic corpus of patient records because there are a lot of regulations for access to such data, and this is like chicken and egg. We need to develop tools, but we have no access to data in order to develop those tools. But those tools are necessary for processing this data. That's why we try to generate partially from different sources which are available, so-called virtual patient records. Here you see a synthetically generated patient records for status, for patient status. This is made actually in the same way like extractive summarization. We use the huge corpora based on the data from the diabetes register, where sentence platted different sentences representing organs and their status. And this was actually about 1 million sentences corpora. And on its basis were automatically classified those sentences to different organs and systems. And this one actually allowed later to develop synthetic patient status generation methods with a lot of rules for constraints and for different combinations of different findings, which is based on this automatically classified corpora of organ systems and their statuses with really high accuracy. And finally, I would like to thank to all the colleagues with which I collaborated for clinical text processing during the years. The first two are Professor Gali Angelova and Dr. Živko Angelov from the Institute of Communication and Information and Communication Technologies in Bulgarian Academy of Sciences. We worked with them in many projects, and actually Živko Angelov is the person who developed the Bulgarian Diabetes Register. Also to Professor Dimitar Churakchev from Medical University of Sofia, who provided the data, and he is the expert who is consulting us with the tasks. And last but not least, to a huge group of very enthusiastic students from Faculty of Mathematics and Informatics of Sofia University, supervised by Professor Ivan Koichev, and also to PhD student Boris Velichkov, who worked very enthusiastically to the tasks for creating resources, to creating and developing different tools for processing medical Bulgarian texts. And some acknowledgements to currently running projects. This is eHealth and IZEDA, funded by Bulgarian National Science Fund, to Ministry of Health, to National Health Insurance Fund for providing some data, and Medical University. And here are listed some previous projects which I actually mentioned as results for our first achievement. Thank you for your attention. Any questions?
Thank you very much. So I would like also to invite any questions. So I cannot see questions for the moment, neither on YouTube nor on this chat. But I have a question. Can I ask a question?
Yeah.
So my question is, so you mentioned that one of part of your work was implemented in a medical hospital in Bulgaria, correct?
Yes, yes. This is the specialized hospital for endocrine and metabolic disorders treatment in Medical University. There, actually, Professor Dimitar Churakchev is the head of the Department of Medical Informatics, and we worked with him for one of those already finished projects.
Yeah. So was your work actually used by practitioners for their work? Did you have any feedback from them?
This is used on daily basis when the patient is actually hospitalized. This immediately is used. It requires actually frequent updates, and probably some of the drugs and medications should be more frequently updated. The list of medications requires a lot of updates on frequent.
Yeah. Okay, thank you very much. So there is one question from Petya Osenova. I will read it so everybody hears it. My question is whether in this task some paraphrasing techniques were used as well.
Yes, we actually we envisioned the paraphrasing techniques in all subtasks for text mining. For some of the tasks, actually the texts were processed as backup words, but for the other tasks were used different techniques for data augmentation using paraphrasing techniques.
Okay, Maria Gritz would like to ask a question. Yes, please do. If No idea, probably she has to type it into the chat. Can you type it into the chat so we can see it?
Here is the question: do you use semantic analysis of textual data in order to map it to an ontology? Actually, Wikidata has really good disambiguation of the terms, and once some term is mapped to some of the ontologies, so we consider that this term is already disambiguated as a medical term. And later, we use the mapping between different ontologies in order to find the associated ICD-10 code of the specific term. For our classification task, we have as an input actually one diagnosis, one sentence, which is one diagnosis, and we try to associate to this diagnosis code, which means we don't search for diagnosis inside in the code. We have already focused the where the diagnosis is mentioned. And in case there are some other words, actually, this is not a problem because the classification task is able to associate not only single code but also multiple codes, because this classification is not one-to-one, but it's one-to-many. For one diagnosis, it's possible to have several codes. In case I mentioned several diagnoses, we can receive also several codes for each of them.
So I have another question in case you don't see any question anywhere. Since this is a very critical domain, the medical, and actually people who work with the medical know that if you make some mistakes in the whatever, there can be some more serious consequences. How do you tackle the evaluation stage, error analysis, stuff like this?
Actually, we have a so-called human-in-the-loop approach. We just recommend something. This is not fully automated process. Also, in the hospital, the doctor is able to see actually where those medications are mentioned, how they are identified, and to make some minor changes in case are needed. According to the classification tasks for diagnosis and codes, this is again a recommendation tool which aims to fasten the process for association of codes to diagnosis, which is made by medical practitioners. On the daily basis, they need for each diagnosis to assign the code, and this too actually suggests some possible codes, and the doctors are able to choose the most appropriate one.
Good. Thank you very much for the answer.